The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Welcome back.
Hello.
This is again the second part of our spoiled milk.
Spoiled milk.
21st. It was 21st. Now it's 22nd episode. Alert. Spoiled milk. Spoiled milk. So that means it's going to be
out.
Kick the kids out. It's going to be a bit unhinged.
Raunchy.
We're going to say words that we're not usually allowed to say. So,
Adult words.
yes. So this is not a little friendly episode. But do we have a joke?
I do. I have a joke.
I'm the only one who doesn't have a joke. Go
I
ahead.
love dad jokes, you know.
Me too. Love them.
Okay. So what did baby corn say to mama corn? Where's popcorn?
That's cute. I love it.
Why do bees have sticky hair?
Sticky or stinky?
Sticky.
Sticky. I don't know.
They use honeycombs.
Oh,
Honeycomb.
that is adorable.
What do you call a cow with no legs?
Ground beef. I never get over that
I
one.
know.
I still remember that one from like many years ago. Yeah,
Babe.
it's cute.
That one is cute.
So, I thought we'd talk about funny, strange, different encounters,
sorry.
requests, comments, things from our patients.
Request. I had a patient the other day tell one of my nurses, "Why have you not changed my sheets and cleaned my room? Is this not a hotel?"
No,
No, it
girl.
ain't no hotel, girl.
It ain't a hotel.
It ain't a hotel.
What is wrong with people?
Are you telling me? Hey,
Hello.
we're unhinged on this one. Just say it.
Get back in the frame.
You're back in the frame, Delana.
Tits out, back in the frame.
Nips up.
Nips.
Hi.
Shoulders back.
Dun, dun, dun.
Okay.
Assume the position.
Assume the position.
Aye, Captain.
Aye, chef.
That's right.
Yes. So we had to explain to the poor
So
patient.
frustrated with me.
He does.
Let's not say
Especially when,
something.
yes.
Yes.
He tries to be like
tries to
so
be all-
sleuthy
yeah.
and quiet about it.
And normally we do that.
But
not
today,
this
not today.
episode.
No.
No. We're not letting it all hang out.
Just say it.
Hanging out.
We need an episode where we introduce him at some point.
Yeah, you do. You need to
Be like,
interview
here's
him.
the person that tries to keep us in line, tries.
Tries. There is no keeping us in line. Because you try to keep us in line, it just pisses us off.
This is true. We don't like being told what to do. Don't tell me what to do.
Not tell me what to
I don't
This is
like
my
it.
chef, and he's been dealing with me for, it'll be 30 years in December.
30 years. Where are you going to go?
Well, 30 years together.
Okay.
We've been 26 years we've been married.
You need
Our
to go
anniversary's
somewhere
in
good.
January. So, yeah.
Good vacation.
Long ass time he's been putting up with me.
Yes.
He did tell a joke the first time. He was like, well, whenever you're around, I don't know what happens to my compliant wife. And I'm like, you have a compliant wife?
Where is she?
I don't know who that is. I've
like
never
hell.
met that
Yeah.
one. Is there another one?
Yes. Sarah has a way of bringing it out of us.
Right.
I tell you that all the time, so I'm not surprised.
I am surprised. I feel like you can do it just pretty well on your
Well,
own.
I can, but you exaggerate it.
So dramatic.
A little dramatic. But yes, we have patients who request for us to go home with them.
Yes.
Are you not going home with me? No.
Do you want to pay me the money? I'll be your official booby holder.
How much you gonna pay?
I'll consider
Wait.
it if the price is right.
I have one. So the old building before the whole COVID thing happened, you know, it wasn't really a big thing. But we had a girl who was going back for a C-section. She didn't want us, and she had a lower abdomen tattoo right there. She says, please don't cut that because I make money off of that.
Oh, yeah.
Okay.
Y'all remember that?
Does it say no regards?
but I've had
No,
those
regrets. No,
No
there's no regrets. Regrets. Whatever it was. No, I
Regrets.
think it was just like a simple flower, but she did her pictures, and that's how she made some money. And where do you think the baby came out of, girl? It had to come out of right in between the
Yeah, your flower.
flower.
Your flower's gonna be scarred
So
now.
yeah, I will tell you, she was taking pictures right after her C-section.
Oh,
I think
okay.
she made some money off of that. And I'm like,
gosh.
Of her flower being deflowered.
I guess so. I'm like, okay.
Oh, yeah.
You get it, sis, I guess.
Well, we had, when I worked at another facility, we had one doctor that was, that was his clientele, was strippers. And they almost all of them worked at one particular strip club. We knew without even looking on their face sheet where they worked at when they'd come in, because it was that particular doctor. I swear his name circulated within
I'm sure.
Sure did.
that strip club. And same thing.
I don't even want to know why.
She was having to go in for surgery, and she was so worried that she wasn't going to be able to make money after she had this surgery done.
You could just have the B shift, girl. You're fine.
Ooh. I'll never forget the tattoo I've seen right across the pubic bone that said, "Lucky you," in huge cursive letters.
Wow. Was it spelled right?
It was.
Was it Lucy you?
Lucy. Lucy, you. I had one with boxing gloves one time.
Oh.
And
Hit it like a champ.
hit it like a champ.
Oh my gosh.
And I
Crazy.
couldn't help myself. I'm like, oh, because you're doing a fundal bleeding check, and it's right there, and I'm like, oh, is she like, she couldn't have just tell me the truth. I can see through you, I think she said something like, oh, it's in honor of my brother who's a boxer, and I'm like, that makes it more creepy.
Yeah.
You should have just told me the truth. Like, you didn't have to lie and make it awkward.
could've
Like,
got-
I
on your
don't
arm.
think he wanted it there.
I don't, yeah. Hit it like a champ.
Hit it like a champ.
Girl, no.
Oh, and walking in on
Oh, yeah. Multiple
blowjobs,
sexual encounters.
Oh, yeah.
having sex in bed,
Yes, when we're specifically like, don't do that.
masturbating. We
Yeah.
have one nurse that's walked in 3 times. I think she's the magnet for that.
She is a magnet. We all have a magnet for certain
Yeah.
things, and she is a
She's a
magnet for that.
walking in on people getting blowjobs or masturbating.
Oh, yeah.
She
I have
freaks out
walked in
because
on
they
that one.
look her in the
Yeah.
eye, and she's like, stop that! What are you doing?
Oh, my goodness. Yeah, I had one of those encounters back when I worked on med-surg.
I was going to say I have a med-surg story, too.
We get the patients, especially in the winter time. They, homeless, need a place need a warm bed.
Yeah.
And so,
Need a place to do it.
but of all things, she was feigning sickle cell crisis. You cannot fake that.
You can't.
If you've ever taken care of a sickle cell patient.
No,
you
they are in
cannot fake
severe
that.
pain.
Yeah.
There's no denying
And I walked in, and she was on her knees, and the guy was scrambling to get his pants pulled up. I was like, okay.
Well, at this point, just go ahead and finish, and just call me when you're done.
Oh, my Lord. She
Oh.
got discharged the next day.
It's time to drink. Drink to that. Drink to sex. And don't ask if you can do it up the butthole either. When we're doing your discharge instructions. No. She just had a baby. She's
Oh,
ripped
wait.
from tip to top.
The from root to toot.
From root to toot.
From root to toot. That's what I tell people. But I do get the questions that are like, well, because, we say no sex, no tampons, nothing vagina for at least 6 weeks or until cleared by your doctor. I get there's nothing wrong with her mouth, right? I'm like, fuck out of my room.
Yeah. There's nothing wrong with her mouth or her butthole. No.
But I've
no.
even gotten the phone calls from Mom asking me if they can swallow.
Well, I give
Because they're breastfeeding.
that gives you protein. It's fine.
I'm like,
Someone on medical
It's-
called one of our doctors one day. Actually, they called and we put him on hold and said, hey, can you answer this call? It was one of the hospitalists, and he had no idea what to expect. And we messed with him all the time because he messed with us. We handed it to him, and he goes, after he was done, he was like, yeah, it's got some protein in it. But he was like, did y'all hand me that careful. I like to piss you off.
Uh-huh. Like to see your
So
expressions.
who answered when she was asking if she could swallow because of her breastfeeding?
Well, it was on the phone.
Do you answer?
Yeah, I sure
You
did.
got the call?
I mean, I don't know if she was pranking me or if she was asking me for real, but whatever, you'll get the real answer.
Yeah.
I'm not afraid to answer.
No, you call me for that question, you're gonna get the real answer.
That's right.
Yeah.
I said, well, if that's what you choose to do, it's not going to affect the baby. It doesn't pass through your breast milk. That was the question.
My brain just did so many weird images at this very moment in time.
But I'm telling you, yeah. We get some
Oh, God.
yeah. We get some doozies.
So back in my med surge days, at one of our house soups, obviously this is like her favorite story to tell of mine. So back in my med surge days, we were both on med surge at the time. She wasn't in house soup yet.
Right.
But I had a patient, and we were in different halls because it's 3 separate halls shaped like a T. And I was in a different hall, and I had a patient she's young. She just had an appendectomy. No big deal. She's recovering from surgery. Probably going to be home the next day. Got her from surgery. She's doing fine. And then I see this dude walking down the hallway. Seems a bit sus, but I don't think anything of it because it's not a lockdown unit like
Right,
Mom Baby
like Mom
is.
Baby, uh-huh.
It is just a free-for-all. You show up, you go to your room, you just know the room number, whatever. This bro, muscular, tight shirt, literally a boombox on his shoulder.
Oh, we're in the 90s.
Oh.
Okay.
Yes, literally a boombox on his shoulder. So I'm like,
That's different.
okay, music therapy. This is grandma. I don't know. I'm just trying to. I've got 15 other people falling out of bed. I can't deal with that at the moment. And then I got a call later from this girl. Hey, I'm ready for my pain medicine. My incision's hurting. So I go in there and talk to her. She was like, well, my friend's just sent a stripper, and he was grinding on me. And I was like, what? What did you just tell me?
Wow.
My friend sent me a stripper. They tried to cheer me up. And I'm like, can you not lie to me? Because I have to call the doctor now. And then I called the hospitalist, who was a different hospitalist. And we fought. And he was young, so he was good. We were, on friendlier terms. And we fought over who was going to call the surgeon. Neither of us wanted to. He said, no, this is your patient. You're calling. And I'm like,
Great.
So I had to call the surgeon, who yelled he knew it wasn't my fault. But he was he had to come see this patient, and he yelled at her, and you could tell he was just because he's normally a kind of sweet, low-tempered guy. And then when he came up there, he was so mad at her, and I'm like, I'll try not to let any more strippers in, but I'm not at the desk, so I can't control it, friend. I mean,
No.
I know.
Is that even on your radar?
it's never been on my radar. It's never happened again. And then, knock on wood. But I'm like, so in my head, when I'm seeing this dude walking down the hallway, I'm like, weird, but okay, you do you.
Right.
And then I get that call, and I'm like, holy
If we kicked out
shit.
every weird person.
Yes, I can't. Yes. Especially in our particular area, you have your school people, you've got your business, you've got your country, you've got your homeless. There's such a wide variety of people.
Yes.
I don't know what to do with them.
And
So,
sometimes the nice business people has the homeless looking people coming to visit them.
yeah.
You're like,
Right?
So, I mean, yeah, we can't stop. And and that, like I said, it's not a lockdown unit. They can just come in the hospital. If they know the room, they don't have to talk to anyone on the way through.
Nope.
So that was one of my weirdest things. I was like, okay, great.
Well, one of the funniest things that my patients have ever asked me, and this made me laugh so hard. I'll probably never forget it. But, we rub their fundus every shift.
Mm-hmm.
And I'm in there. I'm introducing myself. I need to do her head-to-toe assessment. And she said, do you need me to get in the bed? And I said, yeah, if you don't mind, it'll just make it a little easier for me to rub your belly. And she goes, oh, okay. She's like, is this like a Buddha thing? Does this give you good luck? And I just laughed so hard. I was like, okay, do you not actually know why we're doing this? Or like, but it was so funny. That was the best response I've ever
That would be
had.
a great badge reel, y'all. I rub your belly for good luck.
Yes.
I like a little funness,
that
a little
would be
uterus.
Little
Oh my
funness,
gosh!
Yes. Hello. If you make rules, make this.
If you make badge reels,
badge reel
Yes.
alert. We would love it.
Oh, that
So
was just
funny.
the best response ever.
Yeah.
that's hilarious.
And I love my dads who are hilarious and like to joke with you and not just sit over there on the couch and do nothing. I love those dads who are smart asses.
I do too.
Yes,
oh,
I
we
We
know,
don't get
we
along
know
great.
you do.
Yes, because I go right back at you.
Hey, tell them what we did. What happened the other day for our admission?
Oh, okay. So, me and my friend here go and help a patient get admitted.
For a
And-
different nurse. She's
yeah.
doing something else at the time. So we're like, okay, let's go get her settled in. She's got numb legs. We move her over in the bed.
So we talk about teamwork. So that was a teamwork moment. Me and Sarah go help another nurse get this patient settled, get her into the bed, make sure her bleeding's good, take her vitals, make sure the baby's breathing. And I start explaining to the patient what we're going to do for the day, and I need her to move over. And all of a sudden, I have a British accent. I don't know where it came from. I just start talking like I'm British. And I just keep talking and Sarah looks at me and she's like,
Y'all, I'm stuck behind a bed at this moment because we've got the labor bed in there next to the postpartum bed, and so I'm trying to get
4
the rest
nurses.
of her pitocin going in the pump, and I'm just sitting behind the bed looking at her like, what the fuck is happening?
and Sarah's like, are we from Britain?
And then I just called her out. I'm like, so we're British today? Like, in front of the patient. And the dad does. He starts cracking up.
Cracks up. He said, oh my God, we do that all the time too. We'll just be talking and all of a sudden we start our British accents. And we talked and laughed. Well, the patient, I went in there the next day to help her get discharged or something. The patient said, my mom said that you and your friend were the best nurses ever. And
Because
y'all
we
made
were
us
in there for
laugh.
5 minutes.
And I was only like 5 minutes. See, I make a lasting impression on everywhere I,
I
go.
know.
5 minutes is all you need of me. And hey. You remember me
I think
forever?
that was it too. It was just the camaraderie, like the not stressing out. But I was like, are you British now?
Yeah. Called me right out on it.
Alicia.
Alicia. Hey, one time we had an antepartum patient, and me and another nurse, she was scared. She had to go, I think she was going to be induced or something. I don't know. She needed another IV. I'm scared to death of needles. So me and another nurse go in there, and we start singing to her. Can I sing? No. Can the other nurse sing? No. No, not really. Do we care? No.
No.
So we start singing, and this patient starts laughing at us. But, we got the IV in, and she's like, I didn't even feel the IV. I said, yeah, because I was entertaining you by my wonderful singing.
I want to know now, what did you sing?
Oh, shoot. That's been like
Been a minute.
5 years ago.
Oh, okay.
It matters though, like just showing them like your human side and not like I am robot nurse. I
Yeah.
start IV. Like I mean, you have to have a human side to it so you can get on a level with them.
Absolutely.
They're scared, they're nervous, they're in pain.
Yeah. Yeah.
You need a level with them on that. Like,
Absolutely.
Exactly.
It's not beneath me to go in there and sing to you. It's not good, but my gosh,
I'd hope
I'm
you
gonna
sing to me.
you. Yeah. I'm going to sing to you. I might tell you a joke or talk in an accent. I have no idea. I don't know.
You did pretty good.
Whatever comes out at the moment.
It is.
I don't even know what it was, but it was just like something about we're just gonna lift this numb leg right over here, or I don't even know what you said. But I'm just looking at her like,
Let's lift this leg.
what's happening right now? I think it was the chaos drama shift that week. There was so much drama that particular day.
There was.
Like between nurse drama, which doesn't always happen on our unit. But the between nurse drama was so prevalent that it just cracked me up because I'm like, Alicia's just in her own sandbox right now. And I did feel like it was the type of couplet that wouldn't even care. Like
Oh,
if
no.
you were being silly. They'd want you to be silly.
Yeah, you had to read the room.
You do have to read the room,
Oh,
and
for
that's
sure.
Yeah. Yeah. You got to know how they're going to be.
And Alicia,
Yeah.
as this nurse was coming in to accept her patient, this nurse was upset about something. Alicia goes, "It'll be okay.
I tapped your head.
They're there.
It'll be okay.
Okay.
You're fine."
You okay? We love you. We love you.
Goodness.
I like to do that to my family too. When we go out to eat, I was just speaking like Australian accent.
Yeah, you said that's what you told the patient. You said we had an Australian waiter one time, and we started mimicking his accent. And I
Yeah,
was
if
like,
you're from another country, I'm going to mimic you. It's not because I'm trying to be disrespectful. I just love it.
that's what I do too. I'm like infatuated by it.
I
I'm
am
like,
too.
how do I talk like you? Like I'm trying to look stupid, but I don't really care.
Australian men
So-
are the sexiest with their accents.
This is
oh
not.
My God.
You're not kidding.
You can talk to me all day long, baby. Oh, the allergic reaction that came out to the hallway, and her face and lips and
Y'all.
eyes
When did
were
this
swollen.
happen?
So, hey, did you start talking while I was walking in front of the camera?
No,
We're just talking to each other.
Oh, you're not for this? Oh.
No.
Okay. Just make sure.
Oh, you started already?
Well, it's been recorded. I just want to make sure
Oh,
I'm
yeah.
in the shot.
Yeah, we're
no,
just
you're
talking.
good.
Yeah.
We're just talking.
The big fat body walking around talking.
We're gonna introduce you on one of these episodes.
You're gonna get to
so-
sit right here where I'm at. No, I'm gonna come back.
Oh well, I told.
It could be the Halloween.
I
one.
know. I told Elena.
yeah,
I
the
said I'm gonna give her a
Halloween.
shirt because she's gonna be a repeat offender.
Yeah,
So-
we're gonna be a Halloween.
Yes.
And,
Oh my God, can we dress up? We're gonna dress up.
Oh, we gotta do a theme, like we'll all three do something, like we'll think.
Left boob, right boob.
Vagina. My daughter's here in the background watching me, and she just thinks my mother. You should know how it is, Brooklyn.
She's like, I am not part
no.
of this.
I love you. Okay,
That's funny.
back to nursing
Yes.
101.
Do you have any
Yes.
more topics, or are we just telling weird stories now?
We're just telling stories. What were you going to say about allergic reaction?
Oh, yes,
Tell
we
me,
had the-
tell me. I don't know.
Sure. Okay, so it was a horrible day, one of those shifts. We had a patient getting blood, her IV blew. Sarah's patient's having an allergic reaction, and then I have another patient vomiting everywhere.
Like
when I
not,
say
not
everywhere,
just a little bit. It was.
she vomited
A
everywhere.
fountain.
All over her, all
Hey.
over the bedside table, all over the floor.
I would
Aww.
like to note that none of this happened throughout the span of a 12-hour shift. This all happened within 15 minutes of each other.
15,
course it did.
15 minutes.
And then poor Alicia is core charge at this time. And yes, my patient was with the allergic reaction. And this poor girl, like she had a cesarean. And her last one didn't go that great.
No, she almost died.
Yes, and then this one, I'm like, okay, everything's going fine. We're getting up and moving.
Great.
And all of a sudden, she's coming out into the hallway. I don't know where, like a bathroom or somewhere at the time.
Yes, I think he's in the restroom.
And then I come out, and Alicia goes, your patient's having an allergic reaction. And I'm like, what? And I'm like, none of this had happened prior. Like, she had no symptoms prior.
Nothing.
She walks out in the hallway, puffy face.
Puffy.
Like, y'all,
like
her
15 units of
ears were
lip
swollen.
filler.
Like, everything was swollen.
Swollen.
Like, swollen. She was a little Pillsbury dough thing. Like, she was a little marshmallow thing.
My
And
throat's itchy.
my throat's itchy. And
It's
it's hard to
closing.
swallow.
Oh, gosh.
And then so we're like, what? You've been here for like 2 days, and all of a sudden, like,
All
and
of a
so
sudden.
I am racking my brain trying to figure out, what did we give her? What did I give her? What happened? And so we're like, is it the food? Is it yellow, like the dye from the stool softener I gave her? Like, I am racking my brain here because, like, she has had nothing new. Like, of course, we cross match all the medications that we give them,
Yes.
what they're allergic to. Anyway.
Like, I need some epi stuff.
I didn't get Epi. I didn't go Epi route. I didn't go Epi. I threw a ton of Benadryl at her. PO. She didn't have an IV at this time. She's 2
Yes.
days out.
Oh,
2
my
days
God.
out.
So I threw a Benadryl at her. She wasn't quite to the Epi need because she'd
Okay.
asked at one
She was
point.
getting there.
She's also one of the people who's going to write down everything that happens, and she did the time, who she talked to, what happened. So I have to be on it. But you know, Alicia's dealing with like the other problems on the unit, and I'm like, okay. Excellent. So I'm throwing Benadryl at her. I'm on the phone with her doctor.
Yeah.
And then so we wait. She gets better. She washes her hands and it happens again. And I'm like, oh my God. And then so at that point, I'm like, we got to get an IV because I don't know what this is going to do.
Right.
And then so anyway, we called one of the labor nurses down. She's a big puffy thing. I'm not good at IVs. I'm not going to lie to you. I can do lots of other things. IVs is not one of them.
No.
But
Mom baby nurses, IVs are not our strongest point.
no, we take them out. We don't put them in.
We take them out.
Yeah. Yeah. Anyway, so I called the labor nurse down. She's puffy. She's swollen. She gets it. And then she was asking me, she's kind of working with me to be like, let's look at the MAR. What do we give her? What's going on? Why is she so swollen? I'm like, I don't know. This is the mystery I'm trying to solve today. And so, anyway, turns out she's allergic to metal.
Metal. And she had a silver dressing.
She had a silver dressing.
And all of a sudden it just...
And I guess systemically, after 3 days of it soaking into her system, it decided to...
All of a sudden.
Yes.
Yes.
And then,
Holy cow.
but if that nurse hadn't asked that, because it didn't cross my mind, she was like, well, I'm allergic to metal, but like, it's a self-diagnosis, so I didn't think it was important. I'm like, it's important.
Yes. You
So
gotta tell us everything.
if y'all are allergic to anything, that even if it's self-diagnosed and you think you're going to swell up with it, please let me know.
Yeah.
Please let
Why
us
would
know.
a patient have ever thought there's metal?
Metal.
You know what? I'm surprised, too, that they didn't go over, hey, we're going to put a silver dressing on you. I'm allergic to that. Like...
Yeah.
Yeah, I don't know if that's something that they...
Yes, so...
I don't even think I called the doctor. We ripped that dressing off and
Yes.
we're like, no, we're done here.
Yeah, if you're allergic
Yeah.
to metal, you cannot do the silver
Yeah.
dressing.
But she had-
Antimicrobial.
Yeah.
Wow.
She had like itchy hives. I feel so bad. I'm like lathering her the Aquaphor because she's just
Oh,
clawing her
yes.
skin off. Like,
Poor thing.
yes,
It was
I know. I
awful.
felt so bad for her.
Wow.
But yeah, she goes, I took a picture so in case I wanted lip fillers, I could see how good I looked.
Yes. So she could see how big she wanted to go.
Well, at least she had a good attitude.
Okay,
about
sis.
it.
Yep. Okay. All right.
I said, well, your lips
So-
are
I don't need to be able
beautiful.
to swallow
No.
or breathe.
She's
No.
like, fine.
Good.
Fine. I just need to know my lip feel.
I'll just take a picture in case I want lip fillers later on. She was funny about it. At least there's that. But
Do it, sis.
I mean, that always makes a difference. But yeah, that's crazy.
Yeah.
That is crazy. One of my favorite things has been hiding the things around the unit. Little trinkets.
I love it. It started a year ago in March. We would find little ducks, little
I started with
flowers.
babies. Started with
It
babies.
started with babies.
I started with
Yes.
babies. Those were so creepy. I had to move on to something else.
Flowers.
I have another round coming, you
But
guys.
the
I can't wait.
the baby brought me the most joy. Have I ever told you that?
The hemorrhage baby?
Yes.
Are you talking about the one that's white?
No.
She stuck one of the little.
I
Okay, so little trinkets just hidden
In random
places
spots.
among the unit.
Okay, listen.
And I'm telling you, it has brought us together.
It
You
brought
guys,
so much
our
joy.
morale was so bad at the time. And then, like, we were just, like, not having a good time. And I'm like, you know what? I don't know what's going to come of this. People are probably going to think it's stupid. But I'm going to start hiding these little bitty babies all over the unit. Because I'm like, okay, babies. Well, some of them are creepy because they're gray. Some of them are blue. Like, they're just all different colors. But slowly, people started to figure out it was me. And so then other people started doing it
Yes.
too.
Yes. Other
And then
people
so
watch that.
other people started
And
getting their
different
own
trinkets.
and different things. So
And
we
it
were
goes
themed.
with the holidays.
holidays or
Alicia found one from I guess it was
February.
February because it was a little conversation heart. It said I love you.
Oh.
It was-
And I was like,
It hasn't
throwback.
been too long
Yeah.
since I found a 4-leaf clover.
Oh,
Really?
Somewhere. Yeah, I think in the supply room,
Dinosaurs.
hidden
You did
somewhere.
dinosaurs, woodland
there's
animals.
there's one still hidden somewhere in the bedroom that every time I go in there I check to see if it's still there because no one's looked at it yet. It's from last October.
Oh my God.
Okay. And then we got competitive. Like
Yes,
me and
this,
another nurse.
and then it turned into a
even
competition.
The housekeepers. The
Yes, even
Yes.
the housekeepers loved it.
Okay, that's right. Okay, so after you found the conversation heart, I decided I'm getting another round and I'm going to do it again.
I can't
so,
wait. Yeah, we got very competitive.
We had a
like
lot.
we were
Like,
fighting, like
yes.
hitting each other,
It's
pushing each
mine.
other in the hallway, running down. That's mine.
Well, in particular, the one, I don't know if I ever told you, I had a patient who actually started hemorrhaging postpartum, And it was like, I needed more and more hands. Ideally, we need like 4 people to effectively manage a true postpartum hemorrhage.
Yep.
And then you kind of got your nice flow and everything's working. And so when the labor and delivery nurses came down so graciously to help me, and we have the hemorrhage card in there, and she's going through everything, and she's getting ready to, I think, start a second IV is what she was doing. And she pulled open the drawer, and we're all doing our own thing, right? And I hear her say, "Oh, a baby." And I, in the midst of, I think I was drawing up meds or scanning meds or something. And I turned around and peek, and she pulled this little trinket baby out of the hemorrhage cart and set it on the top. And it was just this brief moment of like, in the midst of this chaotic emergency, we're like, oh, okay, back to business.
All right, back to saving you.
It was just a moment of,
Wow, this job doesn't suck all the time. Let me go back to that later. I'll keep an eye on you.
look
Yes.
at that. Okay.
Yes, they were the best.
Don't worry, I'm hanging the fluids.
And I still got all kinds of stuff in my locker that I kept.
I put them around my house as decoration. Like I've got a frog inside like a cactus like that I have, and
Yes, they were the greatest today.
okay.
And the little Jesus babies at
Yes.
Easter.
Yes.
So that
Or they
was-
weren't babies. They were
Jesus,
Jesus.
right?
So I know who did that one as a night shift person.
Okay.
Because I wasn't here for that. But I will tell you, don't remove them because they're hilarious. And in the, the oxygen where you can access the oxygen, you rip that little thing off. If you look in those little oxygen portholes, like there's a squirrel in one of them, a dinosaur in another one.
Yeah, you can look and see them.
You can look and see them. So I don't think anyone's ever going to see them unless someone comes to work on. It's the shut-off valves.
Yeah.
But those little things that you can slide back and forth or just rip off if you're impatient like me. Like, I put them so that you can see them through the portholes. They're hilarious.
That's so
every
funny.
once in a while, I just like to be like, I see you.
I know you're there.
I know you're there.
That's so funny.
Yes.
Other people started doing it across the hospital too. Like I think labor started doing it, and then somebody showed me a cowboy duck. Like it was a little duck with a pink cowboy hat. And they said, "Did you do this in the cafeteria?" I said, "I don't go down there, so no." So I think it started influencing other people to do these things too, which that also is like, all right, this is kind of
almost
dang fun.
everybody loves it. It's a fun little thing.
Oh, yes. Yes, it brings joy. It makes you smile.
It's just so random. You're like, what? I think that's the longest time I've kept a secret, to be honest with you, because I'm like,
I know. It was all like Sarah and you.
Well, we all have.
I
our
haven't been here this whole
suspicions.
time.
Like there were some names. Your name was, of course, one of them in my head. I'm like, it's either got to be her or her or her.
Sarah was my number one thought.
No, it wasn't, because I did one right before I was leaving for a while, so no one would see. I'd be like, I wasn't here. I wasn't doing it.
Right,
like, it took a couple weeks for someone to, like, actually throw my name out there, because I would try to, like, if I'm putting it in the gloves or something, I'm trying to do it way back, so it's like, you won't get to that in a couple days.
Yeah.
But,
Well, it took a while. February, March, 5 months to find one of them.
did it?
Yeah, it was February. I found it just now.
Oh, yeah,
You
yeah,
did
yeah.
it in
Because you never know,
February.
like, I don't know where they are half the time.
Yeah.
That's funny.
Yeah.
Because we'll put it in things that we don't use that often, too,
Right.
so.
Yeah, this was an oxygen tubing.
Or, if you find it way down at the bin of pacifiers, and there's probably like 400 pacifiers in this bin.
They just keep filling it up every day.
Yeah, every day. Yeah, just, yep.
You have to wait till the weekend to find it.
Yep.
So,
Now that we have new people, I do have to do another round.
You do.
oh,
I bought some, so
Yeah.
Do it.
you'll see them.
For sure.
Y'all know. Just
Have
don't-
fun.
That is the funny thing, though, is other people started doing it, so you don't know who's in
You don't know
charge
who's
of it
doing
now.
what. Yeah.
Yeah.
Yep.
I mean, whenever I started finding them, I had to be like, "Oh my gosh, I'm so jealous! Like, where did you find it?" I'm like,
Acting skills.
Acting skills.
I'm not that great of an actress, so.
Well, apparently you were. Nobody figured it out for a while.
You did do good.
I think I had a few in my pocket from when I was still not done hiding them, and I'm like, I found these. I didn't find them. I just had them in my pocket.
Oh my gosh.
But it got so funny, like, one of our nurses, like, she had a bunch of them, and then she started collecting the most random crap. Like, a Kuros cap. I'm like, what do you look like a rat now. Like, you just have the most random stuff. And then so it would be like a whole slew of things that she'd set out. I'm like, that doesn't count. That doesn't count. There was a tiny candy cane off of one of our wreaths, and I'm like, no. No.
Those are not
That's just like the most random stuff. I'm like, what are you doing? This is mine. Mine.
Fine.
She was funny.
She's a little ADD. Or a lot. A lot.
We're a lot ADD.
Yeah, we are.
Yeah.
I think every nurse is a little ADD.
Yeah. Have to be.
You have to be.
You do.
We're all a little crazy, all a little ADD.
Have to be.
Especially after this many years.
Yes. Got to keep it interesting.
Oh, it is.
All right. What do you feel about COVID stories? Can we tell COVID stories?
Go for it. Oh, now I want to know what's behind that.
It's probably the same thing I'm thinking of.
Of when they brought the 6-year-old.
Yes.
Yeah.
Tell your story.
Good God.
Oh, I know where you're going with this.
When I die, this story is going to be etched on my.
It's going to be it's
Tombstone.
one of those things that I'm like, this would only happen to
because
Alicia.
you do
To me.
attract the crazy.
You do.
Yes, it's going to be on my tombstone one day,
All right,
y'all.
this was in our old hospital, guys. So we had an older hospital. We didn't manage our doorways at this time. Labor and delivery managed our doorways because it's still a lockdown unit, but it ranked to labor and delivery. They had a list of patients, including the antepartum patients were basically in our hallway. Alicia was charged, and then...
No, I was sitting at the desk.
Okay,
I was
we're
at
charged.
the front. No, I was at
Oh.
the front. It was my turn to go up there and sit to take temperatures and
Oh,
make
I
sure they
forgot
wore their
we had to do
masks.
that. Yeah, okay.
You were the door.
You were
I
the
was the
door
door
You were
person.
the
greeter.
hall monitor.
Yes,
yes.
hall monitor.
You did a great job.
I did, didn't I? Number one hall monitor. I need a sash.
Yay!
I need a sash.
Okay, but...
Oh my God. But this woman comes up going to see an antepartum patient, and she has this big bag. I don't think that much about it because she's an antepartum patient.
They have a lot of crap with
Sometimes
them.
they
Change of
stay for
clothes.
5 months. You know,
Yeah.
you never know. They move in sometimes because they're there so long. This woman wasn't acting like she was struggling at all. She had this dang bag on her shoulder, a duffel bag, on her shoulder, carrying it in. Just walking. Wasn't even leaning to the side. Like, she wouldn't even have a breath. If I
She
was
wasn't
carrying,
like...
She's been lifting weights for a while.
She had...
if I was carrying a 80-pound kid, I think I'd be a little out of breath. Crap, I can't even carry myself
skipping ahead
around.
of the story. You're skipping ahead in the story.
Okay, I'm skipping. I'm sorry. So she puts this duffel bag over on the couch, and it doesn't make a sound, like nothing. She just lays the bag down.
It didn't say ouch.
It didn't say ouch. It didn't say hello. And the
It didn't
zipper
cry,
was,
didn't do
it was
nothing.
zipped up. Zipped up.
She had been threatened, I'll tell you.
She had to have been threatened. So I get her checked in, and she goes back over and she picks this bag up, doesn't heap it on. She just puts it on, walks past me. I get a call from labor and delivery later. Why'd you let a 6-year-old in? I said, what are you talking about?
We weren't allowing kids in.
Yes, it was a no kid zone.
Yeah.
Alicia, why did you let the 6-year-old kid come back here when you know they are not allowed to come in and it's one visitor policy, and what are you doing? I said, you're crazy. I have not let no kid come in. They said, well, a kid's here. And I said, oh, it was that crazy bitch.
It was a duffel bag.
It was a duffel bag. That kid was in a duffel bag, and she was carrying it on her shoulder like nothing. So sure enough, we got security camera footage, and she went into a room, unloaded that
Unloaded
child,
the kid.
walked out, went back to the room like nothing. And so they walked into the room, and she hid the kid in the bathroom when they would come in, and then they finally caught her, and they ran.
Oh, yeah, that's right. They ran down the
Oh,
skybridge.
yes.
Yep.
Ran for their lives.
Well, I've never been able to live this story down. Like I say, it'll be on my grave.
Okay, you know what, though? Whenever they do a code pink and there is anyone with any bag that is larger than an infant, you will tackle them to the
I
ground.
do. Yes, I do. Yes, they had a medical nurse come be the suspect one day during a code
A
pink.
code pink, which
Yeah.
is we do our drills for Missing baby.
And I had a baby up there that I was watching for a mom. And the nurse is like, oh, look at that baby. Who's that baby? Where's the
Playing it
babies
well.
in the nursery? And I looked at her and I said, you ain't getting this baby. And I'll be danged if we didn't have a drill. And I ran after her. But no one checked her bag. She went through all these nurses. No one checked her bag. But my God, I tackled her.
You sure did.
Like I say,
I'm on to you.
never
Yep.
a dull moment with me.
Nope. You just attract the feral people.
I do. It's probably because I
Funny.
have 3 feral kids.
So funny though.
And that's why you had to join us for this episode.
Yeah.
For the stories. I've got some good ones.
Did you see that?
I do see that.
Okay. All right, probably have one more story in
Okay.
us.
Oh no, Delana.
Tell us one. Tell me
I've told my
something
crazy
good.
stuff. You're also a core charge, so I know you got some good stuff.
Oh my gosh, I don't know. I mean, other than the patient asking me to go out and move their car for them, that was just a couple of weeks ago. Can I give you my keys? Will you go out and move my car closer? Actually, this was a patient's mom. Because the patient's mom we had the patient way down in 28.
Yes.
Yeah,
Yes.
yeah. And she was struggling with her walker and everything to get down to 28.
Oh no.
And then it's starting to get late, and she's going to stay the night, but she's got to leave in the morning. It's just such a long ways down here. Will you go down to the parking lot and move my car closer to the entrance so that it'll be easier for me tomorrow? No, ma'am, I will not get in your car.
No.
That is not something I will do. How am I going to get it?
That sounds like a you problem, sis.
I do not know, but I will not be getting in a stranger's car. No.
No. I'm not going to have the liability of
No.
hitting another car.
I
in the
don't know if
parking
y'all
lot.
know, but
Well,
Delena's
even-
car is so like neat freak, like nice.
It is.
It's like clean. I have the WT version of the 4Runner. She's like, I'm the classy one. Like how
got
fancy it smells so good
Yeah.
in here. I'm like, you're lucky if it doesn't smell like dog today.
Then I got the country car because I live in the country,
Yeah.
way out in the country, so it's always muddy, dirty, dusty, nasty, full of dents.
That's how mine is.
Yeah.
I drive through things I shouldn't drive through. So
We all drive
Yeah.
darker color vehicles too. I feel like
Yeah.
white hides
Hides it
the
better.
dirt more.
And I'm
Honestly.
yeah.
And yeah, I'm getting old
So-
too. I ran into the cart holder the other day at Target. I'm
Oh,
like,
my gosh.
What?
Yes, I
Did you date your car?
No, it just kind of scratched it. I'm like, oh my
Okay,
God.
listen.
I'm
I have
turning into my
decided
mother.
on the way here, I would like a bully bar for mine, and then the matte Herculiner type of paint. So you can't notice, like when I hit a rock or decide to drive through mud that I shouldn't drive through. That's what I need.
Yeah. I need a 4-wheel drive, like big.
I thought yours
Mama.
was 4-wheel drive.
No, it's not 4-wheel drive. I just act like it.
Your BMW sure was not.
No, it wasn't.
I was like, why do you have this in the country?
I had to get rid of that real fast. I need a big old tire thing.
I'm
4-wheel
telling
drive.
you, I love my big old car, especially when the roads are icy.
Yep.
I gotta
still-
get
I got mine.
We still got to get to work.
Still
Yeah.
gotta go to work.
Still gotta
And
go.
I love it because I don't
Yes.
have to stay at I don't have to sleep at
The
the
hotel.
hospital hotel.
Hey, y'all, I spend a little bit on that embassy out there. It's a nice time. If I can just stay the night by myself, have some me time, and then skate to the work in the morning.
And I'm the
Having a
opposite.
great time.
I hate driving in the ice. My husband has to drive me.
Well,
but I'm there.
I
I
hate
show
it,
up.
but-
Go home.
I show up. As part of a nurse, you have to show up in the ice.
Supposed to show up.
Rain,
That's why I bought the
tornadoes,
4-wheel drive,
hurricanes.
Yep.
Yeah. We have hurricanes?
When I come through,
She said, when I come through.
better
Just
watch
get
out.
the
Okay, Alicia.
aftermath.
Yeah, you get the
We
aftermath.
get the remnants.
You get the rain.
That's okay. I like it. I'm here for it.
You got the eye of the storm.
Yeah, I'm okay for it.
Yeah.
All right, guys. Well, it's been fun.
It has. Thank you so much for inviting me. I've had a great time tonight.
I'm glad you came. This has been good. You're coming back. As I said, you're a repeat offender now.
Okay.
So
I can come back. I'm looking forward to the October.
for sure. Well, it's got to be sooner than that. Well,
Okay, well,
yeah.
October, for sure.
We got to plan our little costumes.
Yes, we got to do our costumes, and I'll be a new mother-in-law by then. My son's getting married the 24th
That's right.
of October. So
That's
I'll be a new
right.
mother-in-law. Anyway,
Well, okay.
All right.
And next week we will resume our normally scheduled program without profanity and
Be good nurses again.
and alcohol.
Whatever. You don't know what's in my cup, Delana. Dang.
I sure do. I bought it. And the cup.
And the cup.
All right.
All right, guys. Have a good night.
Bye. Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there is always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA, or text the crisis line, text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.